Gift of the Givers volunteers rush in where many fear to tread. The aid organisation has been helping people deal with natural disasters all over the world. Recently, it stepped in to help thousands of Masiphumelele in Cape Town who were left destitute after a fire. Let's discuss the year that was, what lies ahead from Director Imtiaz Suleiman. A very good morning to you. We're all big fans of the work that you and Gift of the Givers does. What really stood out for you this year?
Good morning, Jane. That question is very easy to answer. COVID-19. It's the year that has kept, it's an event or a project that has kept us the most busiest in our whole history. In our 28-year history, nothing has kept us more busy, either locally or internationally. It has been a sustained intervention from March 11 right up till today and ongoing, obviously, into the new year. This looks like we're going to be running right into February. So COVID-19, its challenges, the hopes, the difficulty, the depression, the sadness, the job losses, the anxiety of medical professionals. Never in our history before have we seen healthcare workers so traumatized, so emotionally and psychologically affected, their families affected, and people, who are in good standing, losing their jobs, losing everything overnight after the lockdown. So it has been a year of tremendous challenge for the country, and we physically have witnessed it being on all the sites, doing distribution and meeting people and speaking to them.
Yes, where do you fit in when it comes to this? Because I'm sure that, obviously the pandemic has dominated this year, but it exacerbates so many of the dire situations that we see across the country, the drought areas, for example.
We've looked at 4 categories. On March 11, we said, when the declaration comes, and the declaration came by the president of a national disaster on 15th of March. And we said primary right now is to save, in inverted commas, healthcare professionals. Without healthcare professionals, there's nobody to see the patients. And you can see that's happening because a number of them are getting infected and many have passed on. So the first aim was to support, encourage having additional staff for healthcare professionals and protective materials for them. So the first idea was medical intervention. Allied to that, after the lockdown by 27th of March, we knew soon after that it'll be hunger. So food parcels and feeding schemes were the second thing. Thirdly, without water, you can't sanitize, you can't wash, you can't clean yourself. So, and given this drought situation, specifically in the Eastern Cape, where we have been involved for quite some time, we needed to increase our intervention in the drought in terms of human beings and animals, in terms of water. And the fourth category where we're involved in is fodder, providing fodder for animals who are starving or hungry. So those are the 4 broad categories that we looked at. Of course, in between, we did a fire like we did this week, last week in Masiphumelele. There were some rains, there were floods, gender-based violence issues we involved in many of those throughout the year. We built a school, 4 classrooms in a school in Escort that was struck by lightning 3 years ago, and they couldn't use it. We've put up toilets, over 100 toilets in different schools. But those what I call minor projects. The main focus has been the COVID medical intervention in various ways. We can discuss that. It's lots of ways we did it. And then the food parcels, we've done 300,000 and still busy. We supported 100 feeding centers and we're still busy, not with 100, but 25. And we're busy. We just drilled another 12 boreholes in the last 3 weeks. And our water tankers are still busy in terms of water. And fodder deliveries are still continuing.
Doing so much of the work that government should be doing. Tell me something. The mental state of South Africans at the moment, since March this year, how are people feeling that you see, and how do you all operate, constantly being surrounded by people who have got nothing or lost so much?
The mental state, there's 2 categories, or a few categories. One is where it is really, really striking, is among healthcare workers at hospitals. And they've been the most traumatized because they're seeing the volumes of people coming every day. The second is family members who are affected. Of course, they see a family person pass on, and the second one gets sick, and a mother and a father both lose their lives. So families and the extended family members are the second one traumatized. Thirdly, are the general public who are afraid of COVID, afraid what's going to happen, who don't want to come out, don't want to take chances. And with them, you include those with comorbidities, elderly people. And comorbidities doesn't necessarily mean old people. It could be people that are young. So, and even very small children who've got ailments from a young age, who've got cancers, who've got some immunodeficiency diseases. So those categories of people, and the general public who's scared. And then you have another category of people who are just totally reckless. They don't have any emotions, they don't have any worries, they don't care, they're just totally reckless. And to them, COVID doesn't even exist. And you have those categories of people. But where we've seen the real dire situation has been in hospitals itself, where doctors have lost friends, medical family members who are not medical, but just because they took the disease home, it makes them feel more guilty. That why did I go home? Why did I take this virus home? My family member died because of me. So that creates a lot of guilt. In our case, of course, we specialize in disasters. My teams are not affected by that kind of stuff. And the team, the word I use is emotional distancing. We have social distancing, physical distancing, but for us, it's emotional distancing. We don't get attached to what we see. If the moment we do that, we have to give up our work. So our teams are well trained. They know what to do. They feel compassion. They feel the hardship of the difficulty. They see the sadness. It drives them more to do what we have to do and take the risk and go to high-risk areas. But they themselves don't suddenly walk down or fall down because of the suffering around them.
Wow. Okay, let's leave it on those powerful words. Imtiaz Suleiman, thank you.